Hello, and welcome to the Health Go Live webinar series. Today's episode is brought to you by your friends at Providence Digital Innovation Group. We would like to remind you that the chat feature is available, so feel free to send in your questions for the panel throughout the discussion. Our speakers would love to hear from you. And with that, I will turn it over to our moderator, Sarah Vaese.
Welcome, everyone. Thank you all for joining us. We're so happy to have all of you out there joining this morning. And I'm honored to have such a great group of panelists joining me today. I'm Sarah Vaese. I'm the Chief Strategy and Digital Officer at Providence, and I'm joined by a great group that I will ask for each of them to introduce themselves momentarily. But just to set up today's conversation, want to sort of frame out what we're going to talk about today. Over the past few years, health systems have been, we often either say it or we've heard the mantra that we either need to disrupt or we will be disrupted. But as the financial strain on health systems continues, we've got increasing competition from either the providers, tech-enabled services, new entrants, and sometimes big tech, which is increasing. And as consumers are really taking more control of their healthcare and their choices around health, we can't simply pay lip service to a mantra of, oh, we have to disrupt ourselves. And we must lean into enabling health systems and really providing a different consumer experience, especially because consumers are in the driver's seat. So there are a lot of pressures to commoditize and consolidate health and health services. It's very real. And on top of all of that, of course, we've got a significant workforce crisis in healthcare that's adding to the operational strain and the economic strain. So we're going to be talking about that, and we're really going to be talking about what does it actually mean to be consumer oriented, and some of the strategies that folks that are joining today have deployed to be able to do that, and some of the lessons that we've all learned. So I'm going to pause there and ask our panelists to introduce themselves, and then we'll jump into the content. Let's start with AG.
Thank you, Sarah, and so glad to be here. My name is AG Breitenstein. I am a venture partner at Define Ventures. We are an early stage digital health exclusively focused fund. I come from a long background of entrepreneurship, started 6 companies, most recently Folks Health and Humedica, was at Optum Ventures for quite some time. And yeah, so excited to be here. Thank you.
Thank you. And I know we'll be talking about some of those companies that you have incubated in the past. So really excited to hear from you. Next, let's go over to Adam.
Hi, Sarah. So glad to be with you in this panel, and I'm excited to learn from everyone today as we discuss this topic. So I work for Class. I'm the Vice President of Digital Health and self-declared patient voice advocate. I'm really passionate about making sure we listen to the patient in technology, and we'll talk more about that. But happy to be here. Thank you.
Thank you, Adam. And last but certainly not least, Justin.
Thank you, Sarah. Good to see you again. Great to be here. Recently joined the Providence DIG team as executive in residence and to be CEO of Praya Health when we spin it out of Providence. Prior to joining Providence, I was the CEO of a patient engagement company. And then prior to that, in an earlier life, I was the CEO of a medical imaging company. So evolved from the deep clinical area into the more exciting patient engagement space. So, thank you.
Super. Thank you, Justin. And I know we'll get into what Praya is and what problems it's trying to solve as well. So let me just go back and summarize. In short, the economics of healthcare are eroding, and the trusted connection between a health system and consumers may be at its most vulnerable now. And so let's start with driving into some of that vulnerability. And I'd love to hear from each of you around your perspective. whether it be within the, sort of pure software space or within tech-enabled services. What have you sort of broadly seen out there in terms of platforms that are trying to solve for the creation of that relationship, or the preservation, or the strengthening, however you want to sort of define and articulate it? What have you all seen out there that may be working or isn't working, but trends that exist? So let's start with you, Justin.
Yeah, so as I mentioned, I'd spent some time in the patient engagement space, and I think that space has evolved quickly. Took a little bit of pause during COVID. I think upfront for the right reasons. There was a focus had to be elsewhere for health systems, but I feel like with Praia and other patient enabling and engagement solutions, that the timing is good to kind of refocus on the patient and the consumer in the way that we have all been accustomed to engaging with digital experiences online. That really hasn't been there with healthcare. It's coming on pretty fast, but it's still, it seems to be the exception versus the rule still in healthcare, that again, in our lives, we've been accustomed to using Google credentials and every other e-commerce experience. And really, there's not a like for like in healthcare yet that takes out the friction in the cycle there. And allows you to have a larger ecosystem. So I think there's it's good timing. As I mentioned, difficult, and obviously, Sarah, being at Providence, what the focus was during COVID era. But it feels like we're back to some of the early adopters and maybe beyond that wave. But yeah, a lot changing fast. And happy to be back into it and excited with the solution we can offer. But I'll let others kind of weigh in on what they're seeing.
Yeah, so just to summarize, I heard you say a couple very specific things. One is like credential federation, so being able to do things like single sign-on across solutions. The other thing I heard you say was actually making taking the friction out and perhaps enabled by something like single sign-on. So those are a couple really great examples that are much more consumer centric. AG, I'd love to go over to you and get your perspective on this. What do you think? What have you seen for folks that are trying to solve for these problems?
Yeah, I mean, I would say that we are in the first inning on this, to be honest. I think we are extremely early, largely for structural reasons. I think we still live in the EMR dominated world, and that is still a transactional and bill dropping machine at the end of the day. And when you pull apart sort of, I think, the impulse to engage patients and pull the curtain back, you very quickly get to problems with identity management, problems with just the basics of being the same person as you encounter the same system multiple times. Even insurers will tell you, as you drop in and out of insurance, you become a new person. We have such a long history of having back-end systems essentially be focused on sort of the financial aspect that we're learning our way through. So I would say, when you sort of pull up to 30,000 feet and you survey the landscape, what you see are a lot of point solutions, a lot of bits and pieces that sort of, ways to communicate with patients, ways to build better CX on the front end, ways to manage identity, et cetera. But a lot of it, to be perfectly honest, is a lot of band-aiding over a system which generally speaking is not designed to center the patient. And that's because healthcare has sort of always been fundamentally financially different from the typical consumer activities that people are used to in their everyday. So we are very excited about sort of the evolution of this world, because I think it promises a lot, but there is some very dark corners of the IT galaxy where those structures and tunnels and pipes and data is going to linger in formats that are going to be very difficult for this transition and continue to push out the timeline, I'd say.
Yeah, I think you're spot on. And one of the things that I really love about what you just said is like we really need like persistence around who an individual is. And who an individual is, we are going to dissect that, but it's much more than just who they are within a transactional, financially driven system of record. They are obviously much broader than that. So I know we'll get into some of that, and really amazing perspective there. Lastly, Adam, I'll hand it over to you just for your perspective, because I know you see the whole market in your role at Class, and you're deeply engaged with all of these different components of it, whether they're these point solutions that AG has identified or something more horizontal when it comes to identity and engagement. So tell us what you're seeing so far.
Well, I want to acknowledge the great World Series reference AG gave us. We're in the first inning, very appropriate for today. Kudos there. I agree. It is very early, and I think we are all anticipating and hoping for the possibility of where things can go. And sorry, you're right. We have a unique seat because we interview provider organizations from around the world. We have vendor partners that we talk with and speak with often, and now Class is starting to interview patients for the very first time, and so we're starting to see some really nice alignment. It's very early, but some of the themes that are coming out are access, because that's where patients want to be. To your point earlier about patients are in the driver's seat, I could not agree more. And also consolidation. Because there are point solutions. Our provider friends contact us often and say, boy, we need help knowing who's out there, and what do they do, and how do we make sense of all this. So more tools around what patients truly need to engage. We're learning more about something as simple as self-scheduling. It's not a new concept. It's not a new technology. It's an imperative for patients. Absolutely at the high end of things. And I'm happy to report providers are talking about it a lot more than I've seen in the past. So good alignment starting to happen there.
I love that. I'm also curious whether you're seeing providers actually do more instead of talking about it, but we can get into that momentarily. So, I think I heard a couple of themes, right, that I would pull out, like sort of this identity, like how do you actually center around a person? And there are technical components to that, whether it be around like a specific identity management or identity federation and connectivity. There's or just how you start to think about that. There's also, it sounds like from AG and Adam, you both referenced this, which is there's a lot of stuff out there, but it's rather fragmented and it may not be centered around the individual. And so how do we start to push on some of that? And then I heard this kind of persistent theme, which is that the EMR does certain things, but it doesn't do the full thing. And I want to kind of go into what that specifically, what are we talking about when we say that? And I want to dive into this notion of data. And according to Rock Health, clinical data, which is what primarily sits within the EMR, reflects just a fraction of the data around an individual and a consumer. And we all sort of within the industry already, and the National Academy of Medicine has estimated that medical care accounts for like 10 to 20% of actual outcomes, or modifiable contributors to healthy outcomes. So other things like behavioral, socioeconomic, environmental factors account for 80 to 90%. And we're so if we kind of bring those two things together, we're missing a whole lot if we're just relying on the clinical record to satisfy the needs around how we center around an individual. So Justin, I would love to go over to you first and just kind of get your perspective on, okay, so if we need to kind of center around an individual and the clinical record only does certain parts of it, But what might be the value to a health system in terms of shifting from a patient-oriented view to a more person-oriented view? I won't even say consumer, because it's not just about like getting people to buy stuff, right? Or be like making decisions actively all the time, but really it's about a person-centered approach. So what do you think is the value in doing that? I mean, certainly for the person themselves, but also for the system that's enabling it.
Yeah, and maybe just to pile on a little more to an earlier point about the ability to differentiate and the competition that's coming. And I'll just use Amazon because they do everything really, really well. I think I saw a stat where 50% of U.S. households are Amazon Prime members, so they already know everything about most of us in the U.S. and they're going to deliver an incredible digital health experience soon. And I know there's some connective tissue, Providence and Amazon, but they're going to deliver a great experience. They're going to focus on consumer attributes and really delivering a patient or consumer first approach to it versus serving up, I'm going to say, a generic commoditized medical record, which is an important part. Like we say at Priac, we're EMR plus, we're not replacing anything. The clinical chart's incredibly important, but really, how do you get into the hyper personalization? To do that, pulling data across a number of different sources, not just the electronic medical record. I also heard recently that the average U.S. adult has health and wellness data in over 70 systems. So how do you pull all that into a cohesive, personalized tool that can then serve it up relevantly? And like you said, it's not just about revenue, it's about what's right for the patient, making it easier and taking friction out for serving up. Let's say if you have cancer and you're logging into your app at Providence to pull up your latest lab results, wouldn't it be great to be served up here? There's a local support group that you can engage with. Or if you're a chronic appointment misser, being served up, hey, would you like a free lift schedule for your appointment tomorrow? All that stuff can happen. It's not going to happen in or out of the EMR. It's going to happen with another system that is going to leverage some of the clinical data, but also leverage data in other data sources. And really the health system, and again, sorry, you know this better than I do, but it can't be the last mile of traditional care. It can't be. There was a good article in Becker's recently about the aging healthcare system, just from a brick and mortar perspective. But if health systems and hospitals are really relegated to kind of that last mile, the economics aren't going to pencil out to reinvest in the brick and mortar. And some of the systems, I think, do seriously risk becoming the blockbuster of healthcare in a certain extent. So they really have to focus on what else. I also recently read 80% of patients / consumers will switch providers over a bad service experience. That could be digital, it could be in person. The article was focused more on the digital side, but when you think about that, the lack of loyalty, and there was also a great article in the Harvard Business Review recently about that said U.S. patients aren't loyal, and that's not a good or bad. That's just a fact. They're seeking service from over 5 different health systems per year. And that's going to increase with the options increasing. So how do you maintain a loyal base? So even if you can't serve up, it looks like we don't have an opportunity to schedule the next 3 days, but maybe we do through an ecosystem partnership that we can enable through something like Priya. So we can serve it up, keep you kind of in the family, in the ecosystem, but recognizing you're going to go elsewhere if you're not, you're not being served up the experience that you want. And I'll stop there, citing other sources, but it's pretty compelling. Got me excited about the opportunity. That's why I got into patient engagement a few years ago as well. I just think there's so much opportunity. I agree with AG. It's early days. We're still at the early, adopter wave for the most part.
Yes, sir. If I can comment just one thing on that. I think, and I think Justin's really right about this. And I think there's massive amounts of data. What I don't hear people talking about, which I think is really critical, is I don't think a lot of health systems have really done a true patient journey. I've worked with a bunch of health systems and I watch them do patient journeys, and literally it's like the journey starts at the door. Like they think the journey starts at the door, and I'm always like,
Yeah.
What about all the stuff
happened before they
before?
got to the door? And then it often ends when they leave, right? And so this persistent sort of notion, which again is sort of baked into the history of healthcare, of they'll come, if we build it, they will come, and we don't really need to worry about them before that. And what Justin highlighted is that our health needs comprise so many different things that health systems haven't traditionally even regarded as healthcare. Let's be honest, right? Support groups, the rest of this, it wasn't even considered. So why would a health system do that, right? So even starting with the idea of what is a person's journey prior to becoming a patient, and using that to really orient what data, because that's the other thing, is I think there's data overwhelm. I think there's lots of data we need, some, a lot of we don't. When you think about the way that even, whether it's Instagram or whether it's, Amazon or any of the sort of digital consumer oriented experiences, they are extremely efficient about the way in which they think about data. And yes, they absorb a lot of it, but they have been extremely judicious about deciding what data actually drives what sorts of behavior relative to the goals of the endeavor. And understanding the journey of the person is the beginning of that, and then laying down those tracks. But we don't have that as an instinct in healthcare. We have this sort of very system-oriented approach, and that has, I think, largely determined the sort of data rails that we ride on, and the structures of the systems.
You both just said a couple things that, again, I want to kind of click down even further. AG, you said, traditional patient journeys start at the door and end at the exit door, right? And then you talked about Instagram and Amazon and all of these organizations that consume a tremendous amount of data, but they point that data very specifically to a goal. And they know which data within this massive amount of data to point at that goal. So bringing those two thoughts together, and it relates to a question that we got as well. We're operating in an environment where health systems have basically zero margin if they're lucky. And in many cases, Providence being that, we're in negative margin territory. And so how do we think about outside the door when we're trying to stay, sustainable? And also, how do we do that within a context where there's tens of thousands of solutions out there that we could be partnering with? So AG, maybe just start with you, and then Justin, I would also love to get your perspective on that. But AG, when you've worked with systems in the past, how have you tackled that question?
Yeah, so I think, and I'll use my own recent example, which was I had to schedule a colonoscopy, which again, very run-of-the-mill procedural, thing that a hospital should want to do a lot of, assuming their economics work. But it took me 4 tries. And if you think about the fact that, whether it's Instagram or any transactional website online, literally thinks about a funnel obsessively all day long, about how to attract patients, how to market their services, to advertise themselves as being the best location for this, service or this product. And then to make that funnel of converting you into an actual consumer as seamless and as slippery and as high functioning as possible, and understanding every inflection of where do you drop off and when do you drop off and what are the things that make you drop off. And, it took me, as I said, 4 tries to schedule this colonoscopy. Very, vaunted health system here in Boston. They should want me to do that as easily and quickly and seamlessly as possible. And yet the friction in the system that is just built in, and this is dead simple. I mean, this is about as simple as it gets. And to Adam's point earlier about self-scheduling, but the point is, there is not that orientation to be thinking about, if we are a health system that makes money in this way, and let's leave the economics aside, because that's just a whole other ball of wax. But if we make money by doing mammograms or whatever it is, whatever the things are, we should be thinking about the funnel that brings people to us and allows us to, step on the gas pedal with respect to making money as an endeavor, as a business. But we don't think that. We still don't think that way, which is always astonishing to me. And so that's why patients have been looking for different front doors. When you also, and we talked about it, in the run up to this, is talking about how people want branded experiences that are aligned with their identities, right? So folks, TIA, other companies that essentially are building, a front door for women, a front door for LGBTQ, a front door for folks of color, that aligns with a much more specific service offering. That's the other piece is, we are not just seers for health services. Like we have, in every other endeavor in our experience as consumers, things are tailored to us, and that experience is deeply tied to who we are and how we want to consume services and goods. And this is another aspect that I think people haven't thought about or continuing to learn about. And that, then shifts you towards understanding how those technology services have to support that approach.
I love that. And, in some ways, what you've just described isn't we have to disrupt ourselves. It's just get people in to consume the core offering of the system, right? It's not something vastly different from that. It's, you just got to get people in. You got to think about where they are so that you can present your offering to them in a way to get them in. And the beauty of that too, and I think to your point, like we can get into the economics and value-based care and all those types of things, but the beauty of what you've described is that it doesn't matter in terms, like you're not forcing folks to manage a really complex set of transition economics. It's just get people in, just get them in, ensure that you're there. It's in some ways, it's, of course, it's easier said than done, but in some ways it's quite simple if you think about it that way. Justin, anything that you would want to add to that, just based on your experience?
Yeah, a great thought. I guess I would just maybe pile on the lack of differentiation, and kind of a little surprising to me, some of the marketing budget, the size of the marketing budgets, and then the acceptance of just relying on a generic app when everyone who's on that platform gets the same release at the same time and the same color and new font comes out, and that's the brand. If you spend millions creating a brand, and I can tell you in Chicago where I'm at, one company's doing pretty well with the electronic medical record market, but I would challenge anyone on the street, do they know when they're logging in what health system they're actually engaging with? It's become the most commoditized version, and I know this from my mother-in-law's experience visiting different health systems, and she doesn't know where she's at when she's on the app. It all looks the same. There's no differentiation, and there's no real personalizations we've been talking about. So like streamline her visit from prior to the visit to post, and stay in touch with her. And 70-some-year-old woman will continue to respond to things if you prompt her. But the amount of effort I've had to do just to kind of get ready for appointments, and then in between care, managing that because there's no proactive outreach, and folks are, will follow instruction, and looking for guidance. And one last piece, when I was at Patient Bond, we had a pretty large urgent care customer base, which I thought was really interesting when I first came to Patient Bond, and like, why would urgent care really? But they're heavily focused on the patient relationship. The old kind of mentality of the adage was treat them and street them is gone. So they're trying to create the real relationship again, to lop off some of that early stage of the funnel that health systems used to have kind of carte blanche to. Very innovative operators in urgent care. They would try things in weeks, not years. Let's tie some messaging around a specific cohort for this and personalize it to this individual, versus let's go blast everyone over 40 who's in this category, and let's assume they all respond the same way. That's just not the way it works. And that was one thing I really was impressed with, was the innovative side of the urgent care business, because they have to be, because it's really about location, awareness, brand awareness, and of course you have to deliver good clinical outcomes. But they're not going to compete for surgeries. They're competing at the front end of the funnel, which I think does drive a ton of the downstream revenue opportunities. So it's pretty amazing with some of the vanilla offerings that are coming from really prestigious health systems. Contrast that with, so what we're looking for at Pria is really to partner with health systems that are mentally past, that a lot of big health systems built their own kind of digital wrapper around an EMR. And I think a lot more want to just be it because of lack of resources. Maybe there wasn't a good commercial solution they could find. Maybe they're still fighting a political battle internally, but it's coming. I think there's a great article also from the CIO of Mercy Health talking about differentiating, and that's one of their core themes and he's the CIO. So one of the core themes out of the IT group is recognizing where the EMR and the CRM have their limitations, but also leveraging their strengths. But they're pretty forward thinking, and systems like that are we're looking to partner with. They're kind of mentally acknowledge that let's focus on the EMR, let it do its job that it was created to do. And there's so many other data sources in different outlets that we're not covering. We also have a really strong ecosystem, I think, strategy at Pria Health and way to enable that through a single sign-on and a federated ID. I think, sorry, you kind of mentioned that as well, but really it's enabling third-party digital solutions. We're recognizing Providence, for instance, isn't going to deliver everything. There's great chronic care apps. How do you serve those up in a frictionless, so I don't have to re-register for that, and I don't have to try to get my data across back into my Providence record. So all those things are starting to happen. We're enabling those as well as some others in the market. So really interesting stuff that, again, lives outside the EMR.
Can I share a thought there, Sarah? I love the question. How do you get beyond the negative margins and the slim margins? And I think the pivot to consumerism, to patient-centered care has to be the answer. My latest favorite analogy I've heard is too often we treat the patient like, hey, you're a guest at a restaurant, but the chef gets to decide when you eat and what you eat and how and so forth. But you know what? If I can't get in to see that and have that experience, I'm still hungry. I still have to go somewhere. And my heart goes out to our provider friends, because it is tough. And it feels like we've said that every year for the past 4 years. It just gets harder and harder. But why is it that my grocery store knows me better? I check in using a phone number, right? And they know me. They know my patterns and history and behavior, and they can adjust to that, and they can cater to that. And I think it's okay to start anywhere, go anywhere. Sorry, you mentioned we have to get the friction out, and I couldn't agree more. If you want me to engage more in my care, make it easy for me to engage. Allow me to communicate. I tried to schedule an optometry appointment, and guess when I have time to do that? It was Saturday morning. They're closed. They say, click here to schedule an appointment. And when I click it, it says, call us on Monday and we'll schedule you. And I'm like, I'm in a webinar. I can't do that on Monday. And so I think that is the answer. It's going to take digital transformation and change management, and realizing, hey, it's not the clinician's schedule, it's the patient's schedule. We have to think that way.
And there are a lot of sort of things that we need to put in place to get there, right? To truly center around the individual. Some of them are technical, some of them are cultural, some of them are operational. Another question that came in is like that data enablement. If we focus more on the data and technology side, is really labor intensive. It can be labor intensive, especially when you're starting to pull in additional data sources about an individual. And not everybody can do that. And to your point, AG, because we're in the early innings, like some of the infrastructure doesn't exist. Some of the regulatory environment is to some extent immature, or it may be actually potentially working against this in some ways. And so we've got a long way to go. How do folks like actually get started on this pathway? And not just like the Providences of the world where we've got 50 hospitals and a huge set of resources behind us, relatively speaking, but how should folks think about enabling or beginning that journey? Like a journey of 10,000 miles starts with a single step, right? So what do they do? Like, how do they actually start that? AG, maybe you can provide a bit of context there.
Yeah, no, I love that you asked the question, because I think we are in a lot of people are in a state of overwhelm. The first thing I always like to do is to start with some sort of clarifying North Star. And what I would say is there's two parts of that. One is actually the patient journey. And I saw a question in the chat about this. And it's literally about interviewing your patients and documenting how it is they get to you, what happens, where did they start, where did they get the idea? You know, Adam's going to schedule an eye appointment. Like, how did that journey begin? And that's really important to really just understand your patients. The second thing is to really establish some very key North Star milestones and metrics. And the things that I always love is when you look at the way that consumer-oriented organizations, you know, think about the world, they think about it in terms of some very key, relatively simple metrics. And simple, I mean that they're conceptually simple, they're not data simple, they're not technologically simple, but they think in terms of things like CAC, the cost to acquire a customer. They think about it in terms of long-term value or lifetime value. How much does this person, you know, generate in terms of revenue margin? They think of things like CVRs, like what is the conversion rate when somebody goes on your website and tries to buy your product? How well do they convert? What's the percentage of people that convert? That's also, you know, relates to your marketing spend, et cetera, et cetera. And then obviously things like, you know, NPS and patient sat, and et cetera. But the point is, by starting with just like CAC, just start with an idea of can we actually calculate how much it costs to get somebody in the door and generating revenue? And a lot of companies, a lot of systems just can't, right? They're like, oh Christ, what are we doing? You know, but the exercise of saying this is a very simple metric, which tells us a lot about what it means for us to be successful, and we cannot generate the data or do the calculation, then starts a work project, which is like, okay, if we had to do it and we have to do it now, what do we have to do to bring that together? Can we at least start with certain service lines, et cetera, et cetera? And I think it's an immensely clarifying exercise to then understand, you know, what services, what systems, what data. And what I would offer is anybody who's doing this should go open a web-enabled store on Shopify or on Squarespace, and like, I don't know, sell your kids' drawings, go sell something. And what you'll see is that to start the simplest of web stores as a solo, you know, entrepreneur, you can get from these platforms everything you need to understand everything we're talking about. And so you quickly gain, you know, traction on how important these metrics are, how important and easy the data are to come by through these other systems. And you start to derive a worldview on how it is we can start to do this in healthcare. I'm not saying it's easy, but what I am saying is that other folks in other industries do this as a matter of like blind reflex. So we've got to learn that and start to build those muscles. But if you just start with the metrics that will then help you drive these initiatives with clarity and with focus, and then build to that, as opposed to trying to start from the other end, which is we're going to get all the data and we're going to build a giant data lake and we're going to do this and that, because I've worked in places that do that. And without focus around what it is that you need and why you need it, you will start building, you know, just like giant systems, which may never actually pay off in terms of value. So I'll stop there.
And maybe just, you triggered one thought on my end. I think 30% of patients actually convert who come to one of your properties as a health system to schedule an appointment. Only 30% convert. If that was retail, that'd be, you know, it's a horrible number. So I want to schedule an appointment and then I leave the site because I couldn't. So not using DexCare. If we use something like a DexCare, which is a great solution, the scheduling conversion goes way up. But personally, I was supposed to have a physical today. Or said to reschedule it, and now it's looking like March, and I'm going to leave. I'm going to find a new physician because I can't wait until March. And they just, you know, effectively let me digitally walk out the door because they didn't offer up any other solutions. And they, you know, someone should have been able to see that I canceled it for today. and tried to find another close appointment, and it's March. And everyone knows kind of the retention numbers. It's 5 times more costly to attract a customer or patient than to retain one, and the LTV for a health system for a family of 4 is approaching $4 million. So think about that number. And so this prominent health system in Chicago, lost me for good, because I'm just, upset that they couldn't get me in for 5 months for a physical. So start with some things that do have some really, really visible high ROI. And then just keep chopping away at things that are near and dear to consumers. And one thing you mentioned, AG, as well, but I'll just reiterate maybe, is talk to your patients. And the flip side, which I always found really refreshing in healthcare, is patients and providers are really open to sharing kind of best practices. A lot of other industries, you keep those secrets to yourself, but ask a physician, ask a patient what they want, and they'll tell you. There's no, most folks in this industry are doing it for the right reasons, mission driven and willing to share. And there's no shortage of like what best practices look like. But talk to your patients. They'll share information all day, because there's nothing more important than healthcare to most of us. And this notion of privacy and security has always been the boogeyman in the closet. Like, we got to get past that. I'm much more concerned with my banking information, which I share routinely, like feels like daily now. But that's been just created as a boogeyman, and it's real. But obviously solutions like Pariah, we've taken that into account. We're going to handle the security piece of it and all the liability that goes with that. But every other industry is moving past that pretty quickly, and that's been an anchor, I feel like, in healthcare for quite a while, and an easy go-to excuse for not doing something.
Just to echo what you said, Justin, I was visiting a health system not 2 weeks ago, and they were sharing similar numbers about retention, and these are patients they know, and they were absolutely missing those opportunities. So, and I also agree. The willingness to share is tangible. Healthcare is too important that we don't share best practices, and I continue to see that. One brief example of how essential it is to just know the patient, and I think I don't think we're to that point yet, but I think it's in the sights, and I hope we get there soon. Going from treating a population to treating a group to treating Justin Dearborn. I mentioned earlier, we're interviewing patients, and we're working currently with 4 different health systems that have let us interview patients about their technology preferences. And just last week, we learned something fascinating, that patients at this individual health system that were of a lower income and had less education than others actually rated their technology higher. And as we started to hypothesize on that, we said, well, what is about that? They're able to communicate using text, and they're able to do telehealth, and they don't have to take time off work. And if they don't have the primary language being offered to them, they have the ability to go and take time to understand it and perhaps Google. And we're just at the very, very precipice of this, but and that's just an example of going from a population to a group. Imagine if we can go one step further and really truly know the individual. So it's absolutely the right direction.
And then ultimately letting the patient kind of personalize their experience, like we do in every other digital experience. So let's start letting them tailor it for what they want to see in the modality they want to see it in. It's just seems obvious, but it's not happening yet.
And just to kind of pull a couple threads that you all talked about, AG talked about something which I love, which is just start disaggregating this massive problem into a couple of things that you can do and a couple of metrics that you can measure. And then you can actually start taking action on it. We talked about CAC, cost per acquisition. We talked about LTV, lifetime or long-term value. One we measure at Providence is MAU, monthly active usage. Just understand how often folks are coming back to you and be able to instrument your journeys so that you know how folks are traveling along the journey with you. And that doesn't take a massive data lake like effort. It requires a couple of very pointed approaches to knowing your users, knowing your consumers, like what we've done with Priya, and then going along their journey with them, and then checking and seeing like how often do they come back to you, how many of them are coming back to you on a regular basis, on a monthly basis, which is a very kind of standard approach within other industries that we've talked about in terms of ensuring that you're top of mind, that you're meeting their needs, and that and then the financial side of it is you're not constantly paying to reacquire in high dollars. So just start small. And the other thing, we talk a lot about there's different forms of data, and one thing that these instrumented journeys where you can actually see how folks are interacting is valuable, is sitting side by side with talking to folks, is that you can ask folks certain questions and they may or may not answer in a way that is 100% accurate to what they would actually do behaviorally, because they may be reflecting on it after the fact. Like post facto is always a little bit different from real time. But if you can view behavior side by side with that, then you get a really powerful set of data that you can bring together to reflect what folks actually need and how they're going to kind of stay with you or not, based on what you can offer. So I just wanted to, I think you all just brought out a couple really interesting points that I wanted folks to make sure that they picked up on.
One thing, just to pull another string on what you just pulled also is, to your point, I think if the vendors you're looking at look at you and with like confusion in their eyes when you mention like CAC and conversion and all these sorts of things, then you're already in the wrong, you're talking to the wrong folks, right? Justin mentioned DexCare, the fact that they can start giving data about conversion rates and all these things means that you're working with folks that understand the nature of these challenges and are oriented in the right direction. But it's a really good way of just doing a quick test on whether or not it's a system that's going to work for you, as if they even understand these concepts.
That's great, and that is helpful in the initial question, which was like, there is a landscape of tens of thousands of solution providers. Some of them aren't going to make it, and likely a lot of those that aren't going to make it are the ones that aren't asking these questions, right? Or they're not properly technologically instrumented to be able to even give you an answer. So AG, we talked a little bit about Tia and folks, and you as an individual entrepreneur, as well as Define as a fund, has been really interested in bringing together this kind of holistic point of view centering around individuals. Can you talk a little bit about how brands like Tia or folks fit into that? And you mentioned, the front door that they help, that folks can identify with in terms of what meets their needs. But one, just tell us a little bit more about how they sort of serve the people out there. And secondly, how did they help you identify and understand individuals within those segments differently?
Yeah. So thanks for that. I think, first of all, and both Justin and Adam touched on this, which is like the N of one problem, which is that we are all individuals, but we also carry identities with us. And a lot of those identities are actually sort of not well served by the healthcare system generally. Both Tia and folks were founded around the idea that, if you are female, a lot of your encounters with the health system persist with this sort of, lack of understanding of kind of what it is that you're focused on from a health perspective. Same thing with the LGBTQ community. So we start, both companies were started with a very basic premise that the healthcare, the general healthcare experience much more needs to reflect sort of, what is the focus of our lives and the focus of how we move through the world. And that's very powerful, that the sense of disconnection from the system is enhanced greatly when assumptions about who you are sort of baked into that system. So to make the experience far better and more reflective of what women are interested in terms of their bodies and LGBT is sort of very obvious, super obvious. And then thinking about building the experience specifically around that, and both folks and Tia and folks, we started with a direct consumer orientation. So we literally started with the idea of people are going to be self-paying for these services. They're going to be like some of them, and often were about $130 a month. So it's a surprising amount of money to be self-paying for. So it was really about saying, if we're doing this really well, people will come and they will pay out of pocket, even when they have insurance for it. And that became the North Star. And it was all about sort of building something that we could really start with a simple group of services that could be done telehealth wise, and then build on that to build a more fulsome relationship. Tia, same thing, with clinic-based approach, but melding in-person, online, a very female focused, really centered around that identity. And when you think about the rest of health, the rest of all of our consumer experiences, we get these very tailored, I'm sure what Justin is getting in his Facebook or Instagram feed for clothing is different from when you're getting, Sarah, and what I'm getting and what Adam's getting. We have this entirely tailored experience relative to all of the things that come to us through our virtual portals. And that is exactly not the case in healthcare. And that was really, it was so simple, but it was so, I think, glaringly obvious to us that because people's bodies and lives and their goals with their health and who they are is very distinct across a lot of big, broad categories, that there was a lot of opportunity to not present, and Justin, you talked about this, that very generic front door, which is essentially brandless, other than its academic idea, identity, or its health system identity. It's brandless. It does not reflect, when you think about great brands, Nike, all this, it reflects a lifestyle. It reflects an identity that people are gravitated towards. If you talk about XYZ healthcare system, that is not a gravitational force. It's just not, because it doesn't speak to people and who they are and how they want to be in the world. So we think this is a powerful lever in the way in which health services and healthcare system, architecture and services and things can be packaged and delivered for people.
That's I love that it's essentially brandless or effectively brandless. Just because you slap a logo on there doesn't mean that there's a brand behind it, right? And not for lack of trying, maybe, but it's just a different orientation towards service and serving people. Justin,
let me just pick one thing out of it, which is also why patient engagement is such a weird thing for me, because I'm kind of like, it's not about, we're going to chase you down to get you to do the smoking cessation counseling, right? Like, nobody wants that, right? And that's the whole orientation of health systems, is like chasing you down to get you to do things you don't want to do, as opposed to building services and systems that people do want to engage with because it represents something about them that they actually want from a positive perspective in their lives.
I love that. It's like your colonoscopy example. It's not just like people don't want to necessarily be chased down just to do a colonoscopy. There needs to be a relationship there, and that extends beyond just that one single interaction. Justin, can you tell us a little bit more about how, you've referenced Priya a couple times, and have talked about it, but how does like the concept of Priya, and then, let's take a couple things, right? Start somewhere, start pretty simple in terms of knowing the user, and then bring in these other factors in terms of how they identify and what's relevant to them. How does Priya kind of knit all of this together?
Yeah, so starts really tactically with the ID. So lifting and shifting the ID out of the EMR into the Pariah Health SPI, which is a patent pending system that's going to manage the ID. And that really enables kind of then that, as AG mentioned, the N of one personalization. So from there, we found early on is the use cases are pretty diverse. We haven't really locked into a group of use cases we think are going to be deployed across systems yet. There's just so many different things that are top of mind for health systems. Scheduling probably will be one of the big ones for obvious reasons, but there's a lot of other things. So then it's depending on what the use cases are in the system, kind of tackling those kind of in order of readiness. And there's again just various different low-hanging fruit at different health systems. But then I referenced it earlier, but worth going back to is really enabling an ecosystem. So, and almost where AG was getting to kind of creating the flywheel around, the Providence brand. And, I'll use Providence as an example. So creating the flywheel around Providence. So recognizing Providence can't deliver everything that I want for health and wellness, but how do we keep track of it? How do we serve up relevant things to you? How do in Providence's case, so I'm waking up and I have a health or wellness concern, I think of Providence first because I know you're going to deliver a secure, curated ecosystem of partners, whether it be someone like Omada for chronic care that I'm eligible for. I'm going to get it served up through the Providence app versus having to download Omada, re-registering it, worrying about my data getting back into Providence. So I think there's equal value in serving up relevant care journeys that the system can deliver, as well as partnering as, there's 1,000, 2,000 digital health companies out there. So, and there's a reason for that. I mean, there's a lot of things that health systems do really well and some they're going to need to partner with. So enabling that kind of federated ID and single sign-on and frictionless experience with the ecosystem partners, I think is critical. And then, sorry, you did reference a little bit some of the analytics. So again, and AG talked about this in every other industry. You can set up a Shopify and you can see the funnel and where the friction's created. It's really easy and cookie cutter in most industries, but let's act on that, serve that back up so this health system can act on it. Because the worst is message fatigue and then not adapting the system when you're serving up an experience that your customer, I'll say, doesn't want. Which we do a lot of that in healthcare. So it starts with ID, but then it can go in multiple directions and some of the use cases we talked about earlier, but and then kind of rounding out with ecosystems.
So, we covered a lot of ground and we probably could have talked for a lot longer because there are so many other threads to pull and so much deeper. This is about as expansive of a topic as it gets. So, I know we didn't cover a lot, like as it relates to AI. We didn't actually get into how AI could help with consumer and patient retention. We didn't get into some of the policy and regulatory environment and headwinds or tailwinds associated with data. We could have done a whole 2 hours around just data and interoperability and all that stuff. So I appreciate all the questions and hopefully we can actually follow up on those. But as a parting thought for each of you, I would love for you to just give me like 1 or 2 sentences for the following thing. You're sitting with a health system executive. You're talking about the future state of their business and their industry, all the context that we talked about, and how much they're struggling with their current economics, the state of their relationships with their consumers. And you're talking about experiences that go beyond the current sort of framework around patient-oriented, actually clinically exclusively oriented. What's your one piece of advice or guidance to them in 1 or 2 sentences? I'm going to go with you first, Adam.
Yeah, thank you. And I've really enjoyed this. I've taken a lot of notes from what I've learned today. And here's my advice. Listen to patients, ask them and involve them. And a lot of the answers to the questions we're chasing are already with the patients. No, they may not be the purchaser of this tech or some of the things where we're headed, but they know and they want to engage. So ask them.
Awesome. asking folks is a big part of centering around them. I love that. AG, over to you.
Yeah, so I would steal Adam's for sure. And I would add, create the funnel for the services that you're trying to support, at volume or at scale, and understand how someone gets to the top of that funnel and every step along that funnel way, and figure out what that conversion rate is. If you were just to do that, I think exercise, you'd probably be shocked. And the exercise of just getting the data together to understand it would reveal so much about, how the system is working or not working, and if you can even answer the question. So yeah, and I would then, have all of my senior executives looking at that same conversion funnel in the like Shopify it, and so in this exactly the same ways.
Love that. Very tangible. Create a funnel around the services that you want to provide. Love that. Justin, final word over to you.
Yeah, well, unfortunately, I have to follow two really smart people in the space, but I would reiterate what they both said, but also maybe and very tactically for self-serving reasons, I'll say, we think of Praya as EMR plus, CRM plus, so we're not replacing. I would say you made a huge investment in a great clinical tool. Let us help with engagement. I thought one of the really interesting stats coming out of Providence is it helps MyChart adoption. Which might sound counterintuitive, at least to some folks, but we're helping, and there's a tangible ROI with more folks using MyChart. It's very measurable. So let us help you, even something as specific as MyChart adoption. So it's not a replacement. It's creating more value around the huge investment you've made. So let's say take the plunge, and there is an ROI there.
All right. Well, so you heard it. 3 things. First, talk to your patients, know who they are, know their needs. Second, build a funnel around the services that you want to provide and how you're getting from discovery to delivery. Maybe that's one way to describe it, all the way through. And then 3 is knit together all of your experiences, all your tech stacks, and bring them together. It's EMR plus CRM plus identity-driven engagement around Praya and other solutions, so you can get the value of the investments that you've made. So thank you so much for the panelists, AG, Adam, Justin. Thank you so much for your insights, and thank you to all of you who have listened today, and to the health team as well. I hope you all have a great day, and go forth and be person-centric.
Thank you to our speakers and to everyone that joined us today. Please visit our website at community.hlth.com to catch up on all Health Go Live webinars. And join us in Los Angeles, February 25th through 28th for VIVE 2024.